Hey everybody, welcome back into another edition of the drbicuspid.com podcast. My name is Kevin Henry, editor-in-chief for Dr. Bicuspid. Glad you've joined us and also glad to welcome onto the show Dr. Greg Grillo. Dr. Greg, how are you, sir?
Hey, I'm doing great. How are you doing today?
Hey, doing great. Glad to have you on. I know you've got your own podcast, so this is no stranger to you, and I'm looking forward to the conversation. But before we dive in, I always love for audience to know a little bit more about you and tell them about your podcast as well, please.
Yeah, thanks a lot. I spent nearly 3 decades in dentistry, grew a great practice, real hygiene-centered, multi-provider practice, grew by about 300% in a short period of time. During that period, I also got pretty involved with the industry in a lot of freelance projects, had a top-rated status on Upwork, which led to a lot of really neat enterprise projects and helping vendors and software companies and all kinds of different groups. And now I'm president of Method Pro, and we are a dental consulting and coaching company. We also do very effective marketing for dentists. We're built as a dental team, dental first. And so that's really where my energy is at this point in time.
Well, I know one of the things that you are doing right now when it comes to that consulting and coaching side of things is you're working with practices in AI and that artificial intelligence boom that is coming into dentistry. But there's some real things that you're watching as well. And I really wanted you to be able to share those with our audience.
Yeah, I think it's a very interesting time. I was looking back at my practice journey over nearly 30 years, and as I look at it, I could identify technological shifts that were very clear. They were very focused. There's points I could list them, like a top five pretty easily and say, well, I remember when we went to digital radiographs, and then I remember when I brought in CERAC, and when I started doing clear aligners and CBCT, and then I moved to cloud-based software. Like these are very distinct points in a practice journey. It was disruptive technology at the time, but it was manageable. We got through it and it all made sense. Right now, with the AI revolution, I mean, come on, even as consumers, I think we're all a little overwhelmed, right? Like everybody's using it and trying to figure it out. And if there was ever a Wild West, I think we have it right now. And it's hard enough as a consumer to be using it, but man, healthcare is a whole different animal and it's coming at us, and the risk, there's a risk in that is what I see right now. And the risk is twofold. The risk is that we use AI in healthcare, in our practices, in a way that really creates a compliance and a safety issue. And that's a deep topic all in itself. The second risk is we don't use it at all. We just say, well, I don't need it. And we miss the leverage and the opportunity that's in AI. So right now, it's one of the biggest shifts in our time. I think probably in our lifetimes, right? That's
Absolutely.
how it feels.
And it also feels like a very confusing time. Like you said, there's so much coming at dentists and dental team members right now. And I think whenever you say, how can AI help? I think that's still a message that we've got to refine as an industry somehow as well.
Yeah, I agree because the thing with dentists, I do a lot of coaching with practices, and I always go back to fundamentals, like especially as things get more complicated and they come at us just a little bit faster, this tsunami basically that's hitting us. We still want to be understand that we're balancing three roles, and each one of them takes 100% of our energy. So we're a clinician, we're a manager, and we're an entrepreneur. It goes back to the E Myth by Michael Gerber, but never has it been more relevant because we can get into a little bit of chaos right now with everything that is coming at us and forget, okay, still got to focus on doing really good clinical work, but I do need to manage all of these pieces, which is people, technology, systems, but I also need to be an entrepreneur. I don't want to miss out because other people are doing this. So it's just a really complicated time. And I think dentists need guidance more than ever, at least again, in my 3 decades.
So I've got to ask the big question. What's the biggest mistake maybe you see with dentists, dental team members, and AI right now in the dental practice?
Yeah, there's a big one. And there's some surveys that look at this a little bit. But what we've seen so far is at least 70% of offices are using some kind of AI without any formal policy, understanding, training. I just did a webinar with a bunch of Patterson reps on Friday, and we had experts on there. One was from the Microsoft AI team, and he was saying, I think it's actually 100% or very close to 100% of of offices in dentistry are using AI in some way, but nobody really knows what's happening. The dentist says, "We're not using it," but someone at the front desk is actually using it. And that's the biggest problem right now is that all these consumer grade products out there, we don't have enough time to talk about all the issues that come up with healthcare, but you could put right at the top of the list is HIPAA. So obviously, if you use a consumer grade product, whether it's ChatGPT or Copilot, there are certain ways to configure some of those products, but you need to know what that is. So ChatGPT, not a good one. They won't sign a BAA. Copilot will if you have the right product in place. But we have offices right now that we're talking to that are putting all kinds of stuff into these products, and that is a huge HIPAA risk with PHI. So understanding how to use it and what to use is a big deal right now because we have teams putting offices at risk. So that's probably the number one problem we're concerned about right now. And at Method Pro, our sister company is DDS Rescue. They're a HIPAA OSHA compliance IT backup. They handle a lot of this, and their advisory board is really looking at AI safety, and this is the top of their list.
So whenever it comes to actually having those standards in the practice and everything else, is that something that you put in the employee handbook? I mean, how do you make sure that those standards aren't just there, but they're actually followed maybe?
Yeah, it's a great question, and it's all still being formulated. We've put a lot of energy into designing that because back to earlier point, I mean, dentists are a little bit overwhelmed with everything, and now you just added this. It was hard enough before AI came along, and now you have this whole other piece to manage, and so you need to manage it the same way you manage other types of risks in the office, whether it's OSHA, HIPAA, whatever it is. And having like a very clear AI policy that's documented, yes, in an employee handbook, it's reviewed at a staff meeting, it's very clear, you know what it should say. Also, doing training as well, not just looking at a policy, but actually training and going through like a CE course. That's something that we have developed and will be ready soon at Method Pro, where you actually take a CE course, get a credit with our AGD affiliation, and then that really helps get everybody on the same page. But from there, you also have to have the right tools in place, the right platforms in place that make sense. And, I mean, the other challenge is that everybody wants to sell you an AI tool, right? So you could go out and spend, I mean, you could easily spend a couple $1,000s a month in subscriptions, and some of them make sense and some of them don't. It just depends on your practice. I think having structure around all of that and having somebody help you get through that is a big part of it, and that's certainly something that we are really focused on right now.
So how do we find those trusted partners out there? Because it seems like every day I get a news release about some AI company popping up in dentistry. How do we make sure that we're actually funneling, if we're going to spend funds in the practice, toward the right people that can really be an asset for us rather than a liability?
Yeah, it's another good question. And one thing we have a vendor checklist. Like, let's try to make this as simple as we can. Let's get you something so at least you have something to go on and understand. And number one on the list is, will they sign a BAA? You cannot use anything in the practice related to AI where they will not sign a BAA. But you also have to understand how they handle data and where do they store it? How do they transfer it? How long is it stored? What kind of bias is built into their systems? Do they have FDA clearance if they need it for certain things? A lot of the interesting thing is that there's products out there that we've heard of that are great AI products for radiographs and all that. They had FDA clearance and they have all the right protocols, but we vetted a lot of those companies. We spent a lot of time talking to them and with our IT experts and really digging in and making sure that they are. And sometimes you find that there's companies that have issues with, well, we don't actually have a BAA or won't sign one. Again, that's top of the list, just starting there. So you have to do some homework and you have to understand what to look for. But we are in a time where I think you need some expert guidance on this because it's not super complicated, but it's really serious in terms of how it's used and how it's implemented. And once it gets implemented the right way, it's crazy powerful what you can do with it.
And I think that's such a key point because I have talked to dentists who said it's too much of a hassle. There's too many hoops to go through. I don't want to mess with that right now. But in your opinion, do the benefits outweigh the costs?
100%, 100%. It's just the overwhelm factor right now, I think is what's tripping dentists up. And things are gonna sort out a little bit as time goes on. But again, our concern is in the meantime, maybe somebody puts themselves at risk. We had a client not too long ago that installed an AI tool or agent on their server and it corrupted their database. And that was a very serious issue. And so I can understand the trepidation that dentists have to like hear this stuff and I'm not sure what to do and I'm not even sure how to use it. So, but at the same time, not using it again is a huge, huge risk because yes, you can. I have an orthodontist that I work with, I coach, and we just helped him get into transcription in a very simple way with his notes. 8 hours a week is what it saves him, which is a day of his life at age 70. So, every week he's getting a day back and he's just ecstatic. So, yeah, it's worth it. But again, we're in a crazy time. It's turbulent water in terms of what to use and how.
Well, you've mentioned a little bit about Method Pro, and certainly I want people to know a little bit more about that, as well as, I plugged the podcast earlier and want people to know how they learn more about you and some of the conversations you're having as well.
Yeah, no, thanks. I did a lot of projects in the industry, like I said, and then after COVID, I just really went full time because I had a lot of neat opportunities with some pretty big companies like Colgate and Sensodyne and Quip, and I've done a lot of those types of projects. But and Method Pro traditionally has been a marketing company, but we've really evolved into a dental coaching consulting company. We can do all of it. We can do the optimization for AI SEO, which is a whole nother topic. I mean, now consumers are starting to look for dentists in the AI. And so how you optimize for that is a whole different thing. And so at Method Pro, we really again are dental first. And that's the advantage that we offer. My podcast is something that I just thought I had a lot of questions so I thought, well, why don't I just start having conversations with some people, just shoestring it myself. Don't really have any support. I just do it. And what do you know? Next thing you know, people are starting to listen to it and I'm getting comments back. And so it's CEO chairside with Dr. Greg Grillo. I just do two a month. And that's what I can manage at this point in time. But we dive into some topics and I'm definitely going to bring on more in the AI world, but it seems like the AI topics are getting a lot of interest at this point in time.
We're going to put that link in the show notes so you can find Dr. Greg's podcast and follow along. But hey, I've enjoyed the conversation. I mean, this is a timely one, and I think it's one that in this age of overwhelm, we overlook the things that we've really got to be doing at a baseline level to make sure our practice and our patients are safe.
Again, the fundamentals are still so important, and that's what I love working with clients. Is I work with a lot of younger dentists, and they're still trying to master those pieces while they're bringing in all of these new segments with AI, for example. But we can certainly help with that. I love talking to dentists. If anybody wants to reach out, we have a page on AI integration for dentists on our website. We could put that in the show notes too. But
Absolutely.
definitely happy to talk to anybody that just needs to kind of find their way through this very interesting time.
Yeah, you need Sherpas right now more than ever with this. So
There you go.
glad you were one of those, my friend. Thanks so much for the time today. I appreciate it.
Well, thank you. It's really great talking to you.
Absolutely. Same. And thanks to all of you for listening to this episode of the drbicuspid.com podcast. A lot of things to figure out with AI right now, and a lot of things to make sure you have in place before you even start down that path. So make sure you're calling the experts, make sure that you're doing the right things to protect yourself, your practice, and your license as well. Till next time, Kevin Henry, editor in chief for Dr. Bicuspid, signing off. And as always, wishing you nothing but success.